Welcome to the Approach to Hypoxia Part 3, moving oxygen from the lungs to the blood. My name is Jason Wechter. In the last two parts, we discussed the air outside, and we also discussed moving air into your lungs. In this part, we will discuss moving the oxygen from inside your lungs to the blood, and this will have three subsections. In order to move oxygen from the alveolus to the blood, we need three major components. Number one, we need ventilation in and out of that alveolus. We represent ventilation as the capital letter V with a little dot over the top. We also need blood flow. This is represented by a Q, also with a little dot over the top, and we call this perfusion. And then finally, we need the ventilation and the perfusion to both be occurring in the same location. When this occurs, we will successfully have oxygen transfer from the alveolus to the blood. Sometimes, however, life is not perfect. Ventilation to a region of the lung could be reduced for a variety of reasons, and perfusion could also be reduced to a section of the lung for a variety of reasons. And if either the ventilation or the perfusion is reduced, we develop something called a VQ mismatch. And this is a very important topic, and it is a very common physiological finding in patients who have low oxygen. In this image, we are using a very skinny airway connected to the alveolus to represent that ventilation to this alveolus has been reduced. As a result of reduced ventilation, the PO2 in the alveolus is now very low. And this is because oxygen molecules are continually diffusing from the alveolus to the blood. If the ventilation does not keep up with the oxygen entering the blood, then the oxygen levels in the alveolus will become very low, and as a result, the blood will also have a very low oxygen content. The previous slide showed reduced ventilation. This slide is going to show reduced perfusion, and we represent this by a very narrow capillary. And when we have very low flow blood going to an alveolus, the total volume of oxygenated blood that will be leaving this alveolus will be reduced, even though we have a lot of oxygen molecules in the alveolus itself. The net result of a VQ mismatch will be low ventilation will reduce the oxygen levels in the blood, and low perfusion will result in very low flow oxygenated blood. And in both of these cases, either if the oxygen level is low or the blood flow is low, the overall oxygen delivery to the left ventricle and therefore to the body will be low, causing hypoxia in the body. In the event of low ventilation, we can fix a VQ mismatch by giving extra oxygen or supplemental oxygen. And you can see in this image how extra oxygen delivered to an alveolus, even though the alveolus has low ventilation, can result in normal levels of oxygen inside the alveolus and therefore normal PO2 or normal levels of oxygen inside the blood vessel. VQ mismatch is a very common phenomenon. You can think of almost any lung disease, infection, inflammation, heart failure, pulmonary embolism, pneumothorax or pleural effusion. All of these diseases result in a VQ mismatch that results in lower levels of oxygen in the blood. In summary, VQ mismatch is caused by either a partial reduction of ventilation or a partial reduction of perfusion. It is very common and occurs with probably almost every lung disease. VQ mismatch, when it causes hypoxia, can be corrected either partly or completely with supplemental oxygen. A VQ mismatch is one of the three mechanisms of impaired transfer of oxygen from the alveolus to the blood that can result in hypoxia. We will now talk about the next mechanism, which is called shunt. A shunt occurs when there is zero exposure of blood to oxygen. Shunts can occur in the lungs, and they can also occur in the heart. The most common cause of shunting through the heart is congenital heart disease. In this diagram, we have created a scenario where somebody took a deep breath in, and then something is now inside the airway and preventing any further ventilation to this alveolus. Therefore, ventilation in the future of this alveolus is going to be zero. Over time, the oxygen is going to be dissolved from the alveolus into the blood, and the PO2 in the alveolus will become very low. When this happens, the oxygen levels in the blood will also be very low. When the oxygen levels in the alveolus become the same as the oxygen levels in the venous blood, the oxygen transfer is now going to be both from the blood to the alveolus and from the alveolus to the blood. And this is going to happen in a balanced fashion. The PO2 in the alveolus now equals the PO2 in the venous blood, and therefore the net oxygen added to the blood will be zero. Even if supplemental oxygen was administered to this patient, the supplemental oxygen would not be able to enter the alveolus because this is a shunt, and the PO2 in the blood remains the same as venous blood, and we still have zero oxygen being added to the blood with a shunt, even when we give supplemental oxygen. A very important detail about shunts is that providing extra oxygen does not improve oxygenation in this patient. And this is a major difference between shunts and VQ mismatch. So far, we have discussed 2 out of 3 mechanisms that can impair moving oxygen from the lungs to the blood. We have discussed VQ mismatch and shunt, and the next topic is going to be diffusion abnormality. What is a diffusion abnormality? In the normal lung, oxygen molecules can quickly pass or diffuse across the membranes from the alveolus to the blood. But with a diffusion abnormality, this process no longer occurs quickly, and it occurs, therefore, slowly. With faster blood flow, for example, when you are exercising, the time available for the blood to pick up oxygen is reduced. And when you have a diffusion abnormality, less time results in incomplete oxygen diffusion. Therefore, lower levels of oxygen in the blood occur with exercise in patients who have a diffusion abnormality. In this image, we are using a gray border around the alveolus to represent some abnormality that is slowing down diffusion. And we can show that with a dotted line, oxygen slowly diffuses from the alveolus to the blood. If we add exercise to this image, the blood flow is going to be very fast. And as a result of faster blood flow, there will be less time available for the hemoglobin molecules to be exposed to the oxygen. And as a result, the oxygen levels in the blood will be even lower during periods of exercise because of the reduced time available for diffusion. So we have now covered 3 mechanisms that can cause problems with oxygen transfer from the alveolus to the blood. VQ mismatch is very common and can correct with supplemental oxygen. A shunt does not correct with supplemental oxygen, and a diffusion abnormality will become worse with exercise.